Living Well, brought to you by CHRISTUS Cabrini Hospital.
In this October, we are honoring breast cancer survivors and also remembering those that fought the fight and just didn't make it. Angie Roberts joins us today, occupational therapist,
Yes.
and also a certified lymphedema specialist. We want to talk about lymphedema for those breast cancer survivors. What is it?
Okay, lymphedema is a buildup of lymph fluid that typically occurs either in the breast, if you've had a lumpectomy, or in the arm on the side of the breast cancer. It can creep up literally any time, either right after surgery or even years later. It typically is not painful and so is oftentimes ignored. And but over time, if it continues to build up, it can be life-threatening in that you can develop infections and then it can impede function.
Okay, but the myth is that it cannot be treated.
Right, but it actually can be, and especially like most health issues if it's caught early. So the thing that we do here at Cabrini, which is very different than other hospitals in the area, is that we educate women ahead of time. We teach them precautions to follow, exercises specifically for lymphedema prevention, and mainly just empower them with that knowledge of what to look for, and then where they can hone in on it early and get in and actually do some treatment.
Well, let's speak to the women in Central Louisiana right now that have it or not being treated for it. How do they go about connecting with you?
Okay, so the easiest thing to do is just get an order from your doctor. That could be your surgeon, your oncologist, even just your general practitioner. Call, make an appointment. We get you in here, do an evaluation, a screening, find out exactly what's going on, and then just take it from there. The thing about lymphedema that's really most disheartening is that typically it does occur later in the process, and usually it's hard to explain to them that this is something that is going to be lifelong. I teach them to manage it and often tell them it's similar to diabetes. We can treat it and manage it, but we can't cure it. We actually have a support group here as well that's wonderful. A lot of support, friendships built, and it helps you get through it.
Learning to live with it.
Absolutely.
For more information, call 866-581-DOCS.